everyone. To those of you who don't know me, I'm Councillor Lucy Neves. I'm the chair of the Health and Wellbeing Board, and today I'm going to chair this meeting in common of the Health and Wellbeing Board and the Community Safety Partnership. And as always, I have to say, please note that it's being recorded for live and subsequent broadcast via the Council's internet site. So thank you all for being here. There's a lot of us, so it's quite a large meeting, and hopefully we'll manage well, but these things can always have challenges, so do be patient as well. And I'd recommend, if there are issues, you're having technical trouble or anything, please do use the chat if you can, or message Naz via email. Okay, so the Health and Wellbeing Board, as some of you will know, comprises senior council officers, cabinet members, representatives from Healthwatch, Bridge Renewal Trust, the North Central London Clinical Commissioning Group, and today we're meeting jointly with the Community Safety Partnership. And as there are so many of us, and we're not going to do introductions at the beginning, but I do ask that if you, when you do come to speak, that you introduce yourself, say a little bit about who you are and where you are, etc. So that's the admin. And apologies, Naz, do we have apologies for absence?
Sorry, just 1 second. We still have people coming through. We do have apologies from Rachel Lizower.
Thanks, Naz. I think I also had an apology just a moment ago from Councillor Mike Carter, who unfortunately can't be with us today either. Items of urgent business?
No items of urgent business.
Thank you. So straight on to declarations of interest. Do we have any declarations of interest anyone would like to make? No. Thank you. And do we have, Naz, any questions? Oh, I can see leader, Councillor Ahmet.
Hi, I just wanted to make it clear, because I was slightly confused myself earlier, in that this is the joint meeting, but after this we'll go straight in. We'll go to the Community Safety Partnership meeting, which is being chaired by Simon Cricker on this occasion, because we co-chair. So I just wanted to be clear in case there was some confusion, because I had some myself earlier. So this part is the joint part, and then we're going to go into the Community Safety Partnership, which Simon will be chairing.
Yes. Thanks very much. Thank you, Leader. Quite right. Yes, absolutely. Thank you for clarifying. Oh, and we still got a lot of people coming in. It is a big meeting. Naz, I'm going to need your help with these hands. I can see.
Okay.
There's a lot on my screen, so I can see some of you. And welcome. Before we start the main business of the meeting, I wanted to make a couple of observations or thoughts that I thought it might be useful for us to run in the background as we're working through the presentations and everything that we have to discuss to see and discuss today. And one is really around the strategic purpose of this joint meeting, how it works, how we use it to its best effect to have a leadership role within some of the key issues that we want to tackle together. And then also perhaps I'm very interested in any observations that everyone who are here has on the frequency and how we use the time outside and between meetings to pursue the avenues that we need to and pursue actions and action plans, etc. So those are just some observations really around the role of us meeting together and how that might work going forward. And so I think the first item is just the minutes of the last meeting. Are there any comments? No? Okay, in that case, can I take that they are a correct record, as I wasn't there? And we'll move to next item 8, if that's okay. Now, is that fine? Do you need anything further?
No, that's fine. That's great.
Okay, thanks. Okay, so move straight on to item 8, which is a presentation on violence against women and girls, and is in your additional packs. And I think, Will, you're going to introduce this item.
Hi everyone, thank you, Chair. I'm Dr. Wilmay Maris, I'm the Director of Public Health. It's really nice to be here at this joint meeting. I'm going to hand over to members of the team to do the presentation, which is in your supplementary pack. But I wanted to introduce it by just saying that violence against women and girls is a really significant priority for the population, not only for the harms that are caused to women and girls at the high end, but also as an equalities issue for our diverse population. If we don't tackle this issue, then women and girls in the borough cannot be the best versions of themselves, and that is what our health and wellbeing strategy is all about. That whatever background you're from, whatever part of the borough, whatever ethnicity, you can be your best self. We have an existing partnership violence against women and girls strategy that we want to strengthen. And this is the first time the Community Safety Partnership and Health and Wellbeing Board have come together to discuss this. So for me, it's really significant. And we're going to give an overview of some of the issues in the current work. But what we're really looking to do today, and this will probably and hopefully be part of an ongoing conversation, is we're looking for the members of the Community Safety Partnership and the Health and Wellbeing Board to really come together as a broad partnership and agree to sponsor, develop and continue to contribute to our broad partnership strategy. And we're committed to involving women and girls and also men and boys into the solutions to this issue. And we welcome that this commitment is shared by the partnership. So as I say, I think the pack is a supplementary pack. I'm going to get it up on screen now and hand over to Chantal Fatania, consultant in public health, Joe Benmore from community safety, Manji Lukman, VOR strategic lead, and then we've also got Seb Ajay Addo, who's going to contribute from the local police as well. So just handing over to Chantal and I'll get this presentation up.
Thanks, Will. So obviously, violence against women and girls is an umbrella term which covers a whole host of crimes and behaviour, which include things like rape, sexual offences, domestic abuse, stalking, harmful practices, female genital mutilation, forced marriages, as well as offences that are committed online. And over the last year, we've really seen that the scale of the issue has been highlighted during the pandemic. So over the last year, 7.3% of women in England and Wales have experienced domestic abuse in the last 12 months, and 25% of women are affected by domestic violence in their lifetime. And very sadly, 2 women are killed every week in England and Wales by a current or former partner. The very tragic murders of women across London, such as Sarah Everard, Sabina Nessa, Biba Henry and Nicole Smallman, have really amplified national discussions recently about women's safety and also the role that men and boys must play in addressing this issue. In addition, Everyone's Invited, the platform, has really enabled many young women and girls from schools and universities to anonymously share their diverse experiences of misogyny, harassment, abuse and assault. Next slide, please. And obviously this is a global issue. It's a huge global public health issue. And we know that the World Health Organization estimates that as many as 1 in 3 women will experience physical and or sexual violence by a partner or sexual violence by a non-partner in their lifetimes. And it can take place regardless of gender, class, income levels, faith, ethnicity, sexuality or age. But we also know that some people are at greater risk of some of the forms of violence, particularly BAME women, those with disabilities, younger women, women who are LGBT, and also men and older women. We really need to focus on tackling factors such as individual factors and societal factors and really try and get a culture of change. Next slide, please. Within Haringey, we know that all forms of VOG are underreported and many survivors just don't come to the attention of our services. But we know that actually VOG crimes are very prevalent, complex, very hidden and very varied in nature and can have long-lasting impacts on those that are affected. In Haringey, between August 2020 and July 2021, there were 780 reported incidences to the police of domestic violence with injury, and that was the 12th highest in London. We also know that there's been an increase in the level and severity of risk at the point of referral. Within our domestic abuse services from April 2020 to March 21, we saw over 640 women supported. Next slide, please. So we obviously have a 10-year VORG strategy, and over the last year, we've been trying to really make progress on the 4 key areas of the strategy. So in terms of developing a coordinated community response, we now have over 100 VORG community champions and 30 safe spaces, which include places like schools, job centres, children's centres and libraries where people can go and get the support that they need and be signposted to services if needed. In terms of prevention, many of you will have seen some of the work that's been going on recently around the 16 days of action. And also we always have a host of activities as part of International Women's Day. We've been working on developing an approach for young people to be able to support them to make disclosures safely, and also have been involved in work to co-produce videos for young people. In terms of support services, we have a range of support services both locally, and there are national services which people can access. Our commissioned services include independent domestic violence advocacy services, IRIS support for GP practices to support domestic abuse victims, and we also have a MARAC which discusses all high-risk cases. We're also working to explore different types of perpetrator programs with a view to trying to implement an evidence-informed program in Haringey. Next slide, please. Over the course of the pandemic, we held a consultation with BAME communities, which really highlighted some of the key barriers which they were experiencing. As a result of that consultation, we commissioned a new BAME independent violence advocate to provide specialised support to those from BAME communities. We also commissioned a mental health domestic violence caseworker to help residents who have experienced domestic violence but also have additional mental health needs to be able to access the correct services at the right time and efficiently. We have developed a VORG guidance for professional, which you can see on the right, which really helps professionals and others to be able to access the services that they need. And we have a new VORG and COVID-19 webpage, which I would, ask you to have a look at, as well as there's a range of different information there. Next slide, please. In terms of moving forwards, over the next year, we really want to work on developing the strategy with partners and residents going forward, and really strengthen our partnership response to tackling this hugely important issue. In terms of prevention, we want to really identify opportunities to work with partners to address the root causes of VORG and try and reduce the known risk factors and increase protective factors, and really strengthen our engagement and co-production with victims, survivors, communities, women and girls, and importantly, men and boys too. And in terms of our coordinated community response, we want to continue to work with community groups and champions and provide safe spaces for disclosure and raise awareness about how to respond appropriately. We will be recommissioning our VORG services, including our offer for schools, our MARAC and our IDVA services, and also a perpetrator programme to help support behaviour change and prevent re-victimisation. In terms of our key principles, we really want to focus on co-production, as I've mentioned, and also equality, to make sure that equality is always considered when we're addressing the diverse needs of women and girls, and really think about how we're communicating the work that we do around services and also different initiatives and programmes. We want to make sure that we're measuring our progress and the impact that we're making and any changes. And in order to do this, we're going to need action from all partners to really have an effective response to VORG. In addition, there are a number of national drivers which will impact on VORG, some that have come into place already and some that are planned for next year. So the Domestic Abuse Act will have implications, and we will be working to make sure that any local things that we need to implement are done. as well as the Online Safety Bill and Policing and Crime Bill, and the Mayor's draft Police and Crime Plan, which will also have local implications. I'll now hand over to Jo. Thank you.
You're on mute, Jo.
Apologies. Just to follow up what Chantal said about the need for co-production and a kind of whole system approach to VORG. We, Haringey Borough, applied for some funding to the Home Office earlier this year, the Women's Safety at Night funding. Unfortunately, we weren't successful. But as part of our proposal, what we did is we pulled together. We were really keen to hear from women and women in the borough, and to get their views about, you know, safety and especially safety at night. And as part of that kind of that initial work that we were doing around the bid to the Home Office, we pulled together a survey which we sent out to all residents in Haringey, and the survey was carried out from the 18th until the 27th of August this year. Really surprisingly, we received nearly 2,000 responses to the survey, which was, given the timescale, was an excellent response. And from that survey, we were able to pull some really key findings, which we've summarised here for you on this screen. And talking just about where women feel unsafe in Haringey, I mean, it would be no surprise that women feel most unsafe in outdoor spaces, for example. And women also highlighted serious concerns around walking on the high street or along roads on their route home. Public transport, again, no surprises, were identified as a safety concern, and especially travelling on the bus and tube, as well as waiting at bus stops or in stations for trains or buses. Again, areas which are poorly lit or have poor surveillance, are generally quiet. So this could be the route home, from an evening out, or a lot of women, as you know, do work in the nighttime economy, so are travelling in the early hours or late at night. And obviously concerns around the visibility of police and or transport staff in stations, etc. Safety black spots such as spaces in Wood Green, Tottenham, Seven Sisters and Haringey wards were highlighted as feeling particularly dangerous. And the survey also highlighted particular vulnerability of women from disabled or older age groups as well as mothers who feel unsafe when out alone, especially in the daytime, as well as at night. Next slide, please. So some of the potential interventions. So as part of the survey, we also asked women who responded to talk to us about some things that they felt would make them feel safer. And as you can see from this slide, some of those were, again, no surprises, things like improved lighting and CCTV, especially at night, well-lit spaces often feel safer. More police presence on the street and more transport staff present in stations, etc. One of the key things that came out was around the need for training for staff in venues, so that they can act as, if you like, bystanders who can act as kind of contacts for women who feel, who are using our nighttime economy or working late, etc., who feel they're being harassed, and they can obviously intervene in a safe way. And also the need for robust policies in terms of our licensing. So, thinking about how, kind of in terms of that licensing piece, how we kind of encourage retailers, etc., to take VORG seriously and to implement policies to support that. Implementing covert processes in venues that could be used by women to raise the alarm, such as Ask Angela, or the use of the scanning, I can't remember what they're called now, where women can scan on their phones for help, etc. And then really the key thing, I think, and I think Chantal did touch on this, is about prevention through education. So it's about how we educate, socialise our young men to get that cultural shift and a change in the behaviour and attitudes of men. I'm going to pass on to Will.
Yeah, thank you very much, Joe. And we've got this summary slide, but actually what I thought I would do first is invite Detective Superintendent Seb Addo. We've got a slide in here from the police, and it'd be good just to complete the presentation before we come back to that discussion, which is really about how we can strengthen this and how we can all be involved and sponsor this work. So I'm just going to hand over to Seb if he's in attendance.
Thanks, Will. I'm just waiting for the slide to come up. So I think what Will and the other speakers have spoken about is a holistic approach, which is really important. And I use the 4 E's analogy, where we're very much focused on engagement, education. We do need to evaluate our approach, but a key plank and a key focus for me is around the enforcement. So it's really targeting sexual predators, identifying them in our communities, and us police taking a really proactive, positive approach in terms of how we manage those. So in terms of the slide here, I've started off with our ambition. So what we're looking to do is align our Haringey cross-partnership walk strategy with the Met's own walk strategy. So the walk strategy for the Met, and I've listed the ambition there, but in essence, it's just really prioritising this area of business, really focusing and making sure that we're taking a really acute approach to this, because there's plenty of work to be done in terms of boosting the trust and confidence of women and girls in our communities. So one thing we've done locally, and this is something that's quite unique to Haringey and Enfield and the BCU, it's something that the BCU commander has committed to, and I've spoken to him, he's fully committed with this, is we've put together and we've mobilised a dedicated team of 15 investigators. They're roughly a 50-50 split in terms of gender, but this team, Operation Heartzone, is there to exclusively focus on walk, and it commenced in a couple of weeks ago, but already we're starting to see some immediate results. So some of those immediate results are as recently as last week, we had a 16-year-old victim of sexual assault in a public space. We rapidly identified the sexual perpetrator. He was arrested, charged and remanded, so he's currently in jail. We also had a registered sex offender who to date for 2 years had evaded police. Our team, because they're investigators, we've got a really fantastic skill set within that team, worked really hard to research and identify where that registered sex offender was. We've located him. Again, he was charged and put before the courts. And as recently as yesterday, again, we had an 11-year-old girl victim of sexual assault, and the team very rapidly identified the perpetrator and brought that person into our custody. So I think the key message I want to put across is that by having that focused mobilisation of a team that just looks at this area, we're looking for really good benefits in terms of enforcement. And I'll finish by talking about some of the things that we're looking to do. I know Joe mentioned some of the public spaces. We're looking at a drone deployment in Finsbury Park. We know from the TTCG data, from our intelligence data, and from also street safe data, that it's parks and open areas where a lot of women and girls feel unsafe. So we're looking at using technology, drone deployments in those areas, not just to identify suspicious behaviour, but also with the cooperation of our female officers to approach lone females and ask them and just promote the fact that we're on their side in terms of their safety, and also just asking them questions. We're here to support and getting their feedback as well. So I'm really positive around the drone deployments. It has been used in other boroughs. I think Lambeth and Southwark have used that, and also NPAS, which is our helicopters, and it's worked to really good acclaim. So we're hoping to replicate that within Haringey. And then to finish off, we're also looking at not just in terms of criminal justice outcomes, but is there any other civil remedy that we can utilise in order to disrupt sexual offenders? So we're increasingly looking at stalking protection orders, sexual risk orders, and domestic violence orders as measures to really disrupt sexual perpetrators. And as an example, currently in the Met, we're third in terms of the amount of sexual protection orders that we're putting forward to the courts, and we're second in terms of domestic violence protection orders. So there's a lot of really good work that's going on within that space, within the policing teams. Thanks, Will.
Thank you very much. I'm going to stop sharing now. So I think that was gave a real overview of the level of complexity of this issue and the different levels that we need to operate on. So some of the presentation, and particularly that last bit, talked about the high end and how we respond to perpetrators. But then significantly, I think we want to intervene earlier. So the stories that we heard there from the detective superintendent, we don't get to that stage. We're identifying behaviour early, and even before that, we're changing behaviour from a young age in men and boys, and we're challenging some of these norms that we have at the moment. So I'm going to hand it back to you, Chair, but the questions that I wanted to pose, again, this is a hugely significant issue for our borough. We want women and girls to feel safe and feel that they can be their best selves. So I really want this group to own this agenda, right from those universal prevention interventions to those more targeted interventions at the top. So my first question to the organisations around the table is, I know we've been working together on this already. How can we strengthen that work? How can each organisation do more? And my second question is, how do we involve residents in this journey?
Thank you so much, Will, and everyone, actually. That was really useful, and you summarised a hell of a lot of work and a lot of thinking to a really short space of time, so I can credit you with that. Thank you. So I'm going to open up, and I can see hands already. Anne, I'll take.
Thank you very much, Councillor Desneves. And can I also join you in saying that I thought this was a really, really helpful presentation, full of information and absolutely wonderfully it summarises all the issues and shows the partnership working. So thank you, Will, Chantel, Joe and Seb. And Will, I think my contribution is answering both your questions about what more certainly what more we can do, and mine is about working with children and families more. And I absolutely firmly believe that this is an early intervention strategy, that if we work with children and young people, boys and girls, little ones in schools, and get that restorative behaviour approach going forward, embedded within them, it reduces the likelihood, I believe, of them becoming perpetrators and victims in the future. And so I think that in all our strategies, that if we could look to see what more we can do with children and young people, and building upon all the good stuff that is already taking place, that really is an early intervention strategy. I don't know if it's helpful for me to share a thought that I had, but I will share it anyway. Storytelling, I've been a practitioner for over 25 years. Yes, it's probably even a little bit longer than that. Thank you, Will. That means that children and young people born when I first started practicing are now adults. And if we had managed to successfully integrate, make changes in the way that they feel about bullying and relationships in their own safe space, then maybe that we would have been able to change those numbers that existed 30 years ago about the number of women killed every week. The other point I wanted to add is that when those women and men are killed, that children or even experience domestic abuse, and children are harmed too in those incidences. So if you get the number that Chantel mentioned, it was about 700 plus crimes. There are children in those families, so they too are victimized, and and we know when they're older that they talk about the abuse that they suffered. They will either internalize it or become perpetrators. So just to reiterate that I really firmly believe that work with boys and girls in schools, young people, is an early intervention strategy. Thank you, Will. Thank you, Councillor.
Thanks, Anne. I think you're spot on, aren't you? I think that's a really strong reference to make, to think about those young people that you first worked with. And we've had conversations before, and I've talked about our children in primary now, and where will they be in 10, 15 or 20 years time? And those are big, important questions to ask us. So thank you so much for that. And you will know that Councillor Brothers and I have been talking about how we can work better, strengthen our work, support schools better, because it's no secret to most of you on this call that there are behaviours, there are things that emerge at school. I know you're really familiar with this, Anne, and we need to do everything that we can to enable schools to tackle that well, in amongst that big other things that they are doing and the pressures they face, especially at the moment. And I could see that the leader wanted to come in. There I.
Thanks. Will, I think that's exactly the question to ask, and Anne, I couldn't agree more regarding the prevention and early intervention agenda. I think that's absolutely right. But I just wanted to make a few points, and we are talking about Sarah Everard and Sabina Nessa and others, but there was a recent example in our borough, not even a mile away here. A woman was murdered only 2 weeks ago. By her ex-partner. Her and her father were murdered. So I think we need to, it's a bit closer to home. And I think we also, I mean, I'm not sure what our response is to that, because it did happen. I was on the estate on a few days later because I had a surgery booked up there. It's actually the ward I represent. And Simon very kindly made sure that there was officers there as protection, but I think they'd been on the estate every single day anyway. So I think the police's response was quite clear. I guess it's just in terms of other agencies what the response there is. And when I was sat there, having the surgery along with my colleague, Councillor Ibrahim, there were people that were coming in, and one woman said, they were talking about their experiences of this woman who had died, had been murdered, and her partner, and they, there was things said like, you could always see there was a problem, you could see she looked frightened, and me listening to that, there was mental health problems, I think, so that was all said there. And I think, as I said, the police response was quite clear, but what I'm not clear on is what the response is from the other agencies as well. And I think it's something we really need to think about, because this was on our doorstep. So we are mentioning names that happened in London of women who were murdered, but this was a woman that was murdered alongside her father in our borough, not even a mile away from where I'm currently sat. So I think it'd be good for us to have a response to that. But I just wanted to make a few other points. I did have schools on my list as well, which Lucia has already mentioned. I was at Hornsey School for Girls only last week, and they were talking about these issues and saying, how do we have a direct voice to you? And I think there's probably a piece of work, a project, something that we could do in terms of engaging with those women, young girls across schools in Haringey. The other thing I wanted to say is around, so within our presentations, we speak about BAME and we say we had a BAME work of it. I think we need to drill down into that a bit more, actually, in the context. BAME can mean lots of things. And I think in the context of Haringey, when you're looking at your locality, I think you have to be a bit clearer. What we don't want to do is clearly stigmatise groups, but I think we need to be clearer so we can target that support and we can make sure that we are using correct language, tools and whatever leaflets, etc. To engage specific groups. So I always want to push on that. I know it's a helpful term, but sometimes it's quite unhelpful because it doesn't give us the detail that we perhaps need when we're looking at our specific local context. And the other thing I will say, and this comes up all the time, whichever meeting, is communication. So there is lots of joint work going on, and Seb, you spoke about the joint operations. It would be really good to communicate some of this and to think about how we jointly communicate that. And I know we've started doing some of that, but whether it's between us and the police, us and health, I think we need to jointly communicate this, because since this has risen to the top of the agenda, there's always a lot of questions asked. What are you doing? What is going on? You know, so I think as much comms as possible, it'd be good to see our teams working as closely together as possible. And I'll leave it there for now.
Thank you. Really important points. Thank you, Sarah. And I think we'll come back to some of them. But I'm going to take people in order. So Jeffrey.
Thank you, Chair. And I feel tempted to start from where Councillor Med left, which is on the BAME stuff, but I think that's probably for another time. But suffice it to say, I know there's a lot of debate right now around that. I think I was reading somewhere the BBC has stopped using that word. But I think it's helpful in some contexts, but we need to be really mindful and drilling down, like Councillor Med is saying, and not use it as a lazy kind of way to do. But that's for another time. Some of you will know that, by the way, thank you, Will. I think it's fantastic presentation and the team, and it is an important topic, which is why we included in our expo workshop. Some of you were there. And I thought I'd just give you a bit of a flavor of what came out of that workshop, because really good stuff came out, and we intend to share that more widely. But the issues that the groups were expressing was probably something around accessing services for people who may be at risk of all of this, and stuff around how do we make sure that some of the barriers that they may face, and dealing with some of the cultural awareness as well, and some of the issues and how abuse may be interpreted in certain situations. So we need to be able to have that sort of discussion. The other thing was about raising awareness. For example, better training for groups, not just the VCS organization, but others as well, in terms of recognition. Because I think, like safeguarding, it needs to be everyone has got a part to play. So how do we undertake that engagement piece of work? I think is something we need to think about. There was interesting contribution, for example, for some of the Jewish women's group who were at the meeting, and how some of the work needs to be done more, and how they could be better done sensitively there. And the other place, there's quite a lot, but I'll just give you another one or two, which is, for example, working with men and boys, like has been said in Chantel's thing, and how we can start as early as possible and work with schools as well, and families and parents. And the last thing I want to add is some people felt that this, sometimes calling it domestic kind of maybe minimize what it is, because it is abuse, it is violence, and perhaps we need to mind our language sometimes. But what's important is that to do this properly is going to require some resourcing, and always is the question where we end up, how will we do that? Thank you.
Thanks very much, Jeffrey. I'm really glad that you summarised that event. You're right, and actually I was at that event, and I think we brought in quite a number of organisations across the borough, and one or two I hadn't come across, so really helpful. And I think they're going to be some notes from that session, which will be really useful to circulate when they're ready. So thank you. Jonathan.
Hi there. For those that don't know me, I'm Jonathan Gardner, Director of Strategy at Whittington Health. I guess I just wanted to pick up on Will's challenge to us as as partners, I guess the thing that I would take away, I know that we're doing some work in our A&E, with the police and with others around this issue. What I don't know is how well it's tied in, because obviously officially we sit in Islington. So I imagine it's tied in with Islington teams and directed that direction. So I wonder, I'll take away to check that we are liaising well with Haringey in a similar way, and that we don't sort of lose that cross-border working between the two boroughs.
Thanks, Jonathan. That's really helpful and a really important point you raised. And I can see Sharon's raised her hand, but I thought I might just come in and say, I think in the council we've talked about VOG, or our strategies and approaches to combat VOG in every policy. And I think that's a question for me as well around health, is how well that can be done, and I know I'll challenge it. I guess I'm challenging not so much you, but broader for all our partners on how easy and how much can be done to think about how we combat violence against women and girls in all of our health contexts. in primary care and beyond, as you're describing in A&E. So it's heavily on my mind, and I wonder if Sharon might be coming back in on that, but I'll take Beverly first.
Thanks, Councillor Desnes, and thanks, Will and the team for really comprehensive presentation. I suppose I wanted to surface another sort of significant priority for the borough, and that's about mental health and well-being, because I see this as a theme that runs through a lot, quite range of our activities, but perhaps never more so than where we're dealing with issues both to do with the prevention and the aftermath of violence against women and girls. And I go back to the key principles that Will outlined in his presentation around co-production, equalities, communications, outcomes, and how we measure how well we're doing, the whole sort of concept of partnership in how we work together. And it seems to me that if we agree that identification of significant themes such as mental health and well-being are strands that should run through our approach to tackling these issues, it might set a useful sort of framework for how we can address a number of the issues that have surfaced here. So I'm speaking about mental health and well-being in the widest sense. We know that the aftermath of the pandemic has really heightened this issue within our communities. There's something for me around that very preventative early intervention approach, how women and girls can maintain good mental health and well-being. There's something for me around perpetrators, that early intervention that Anne and the leader reference in terms of that preventative approach and awareness raising. But then there's something around, maybe towards the other end of the spectrum in terms of people with more significant mental health needs and how that might play out in our communities. So it does call or suggest to me that if we can identify and agree that a theme such as mental health well-being is a really useful organising framework for us to address our partnership working, it could be a step in the right direction. Thanks.
Thanks, Beverly. That's a useful suggestion, and hopefully some people will come in with their thoughts and responses to that. But for now, Sharon, can you come in?
Thank you, Councillor. I'm reminded by Anne's comments of how long I myself have been involved in these issues. I think it must be about, I think if you look in the council minutes, there will be a meeting around about 1985 when I was chair of the council's women's committee, where we had just this discussion that we're having now. And it's actually quite depressing that we are still struggling to deal with these issues around violence and the safety of women on the streets in particular. So, I do find this all just going round and round in circles sometimes. But the specific point that I wanted to make was that I think often this issue is often felt to be, particularly in terms of women's safety on the street, it's often felt to be one that concerns maybe younger, active women that are round and about, going to things in the evening, coming home late from entertainment. But there is a particular perspective which we shouldn't forget from the point of view of older women, for whom just the media coverage of these issues means that it's isolation. People will not go out. Older women will not go out late at night. It's absolutely isolating situation for so many older women, and we need to think of a strategy which is directed to them in particular, and to think in all of our policies about the effects on older women of, for example, things like parking. If you restrict parking for women, they will not go out at night because they are so concerned, particularly older women, of going near transport hubs, getting on and off buses late at night. So we need to look at what we can do around this issue across all of the council's policies, not just the obvious ones, I think. That was the only point I wanted to add.
Thanks, Sharon. You're quite right. It is about all age groups, and I think we might have seen that in the survey as well, and Joe might come in on that. So thank you for that contribution. Zena.
Hello, I just wanted to pick up, well, actually, I'll take up briefly where Sharon left off, because there were a set of statistics out yesterday which showed that the gender pay gap hasn't really narrowed in the last 25 years, although there has been some improvement once you take into account the fact that women's educational achievements have improved. So there's more women with higher levels of education, and they do earn more, but overall the systemic gap is still the same as it was 25 years ago, which just takes us into a much wider realm around equalities, doesn't it? And kind of, how much progress have we really made? I think that it's been a really helpful discussion, a really wide-ranging discussion. The bit that I'm not sure that we've covered is the extent to which we need to put women and girls in all of our conversations in everything we do. So we kind of, I think, have got much better about thinking about the safety of women and girls. We've talked about some of the policing response. We've been thinking about the safety of women and girls in parks, on some of our streets and things like that. But actually having women and girls' views embedded in designing housing in the first place, designing estates in the first place, thinking about, kind of our economic interventions so that women are able to, kind of deal with some of the other fundamental inequalities issues. Because as we know, that the problem is not just that women are not safe, it's that there's a kind of set of structural and systemic inequalities which contribute to that lack of safety. So we kind of need to tackle all of those issues in a holistic way, and picking up those other strands, I think, in the conversation will help us take it forward.
Thanks, Zena, you're quite right. And it's certainly for some of the members, so many people who are here, we've talked a lot about workforce in health and social care, haven't we? And we're really conscious and aware of the role of women in that workforce, and also the disproportionate effect, some of the disproportionate effects of the pandemic on that as well. So I thought I'd just pick those out as things that are prominent in my mind when we chair those health and wellbeing boards, for sure. But you're quite right, in every policy. Here we go. And Joe, I've got a comment. I'll read that out, Joe. Joe's comment in the chat there. Understanding intersectionality locally is also fundamental to ensuring all women's voices are heard. Quite right, because we know we don't hear all women's voices all the time. Absolutely. Natalie.
Hi, I'm Natalie Fox. I'm a Deputy Chief Exec from Barnet, Enfield and Haringey, which is a mental health trust. So I think as an organisation, we are pretty alert to domestic violence, in terms of perpetrators and victims. But I think there is more we can do around prevention and early identification of issues. I'm really happy to work with Will on looking at what more we could do.
That's great. Thank you. That's great to hear. Really useful to make sure that we're admitting a few people again right now. Sorry. I think really good to think about that focus on prevention and early help, which is for us a really important part of our next phase of work, really. Sharon, did you want to come in again? No. Zena Brabazon. Zena, come in.
Yeah, I just want to follow up what the other Zena said. I agree about that. I think that all this stuff is systemic, and I do think that one of the things as local authority we can do is to start trying to think when people are working on policies or reports or whatever, to have a sort of a women's comment almost. I don't know whether, Sharon, you did that when you did the Women's Committee all those years ago, but because there are issues about how women see the world and how women experience the world, which is different, I've often because women mainly are the main carers for children. So in our design guidelines, does it work for pushing a buggy, or women are the main carers? All those sorts of issues which impact on women's lives completely. I think that we should have a much more holistic view about that. And I absolutely agree about design. There was talk about that on the radio the other day, and how women architects design differently, and that comes into then you think about how housing is designed and so on and so forth. But so yeah, it's a much broader issue about equality. So I just want to say that. And in terms of
violence against women and girls, I think we have to be able to remove the stigma of women talking about their experience of violence, because domestic violence can happen to anyone across class or race, and we have to be able to, I think, share those experiences in order that people, we were much more open about it, you know, so we talk about that. And I think that would be a useful thing. And the other thing is that in our youth service and our youth work, I think we have to be addressing issues of power relationships, because so much violence is about power. It's about power over people. And men, I'm sorry, I don't want to upset the men here, but about men exerting power over women, power and control. And we know all this. But we have to talk, if you're going to talk about violence against women and girls, we have to talk about issues of power and how that plays out. And I think that's an important part of the curriculum in school, but also in our youth work and our youth curriculum. So those are the points I wanted to make.
Thanks so much, Zena. You're quite right. And I sort of think, you know, that question, what would the woman say about this design, is an interesting one and a good one. And you're spot on. Of course, it is about power, and it's about us in Haringey and what things that we can do really practically, both at preventative end and then at a support and to challenge some of the structures that are around us and enable, as I think Will said right from the beginning, women and girls in our borough to flourish and be who they want to be, really, which unfortunately we know is not the case always. I wanted to just create a second to ask anyone who's not spoken they'd want to come in now. Of course, no hands are going to go up. But I am going to invite you all to do something else, which is that after this meeting, I would invite everyone, whether or not you've spoken or not, to just reflect on what we've discussed here and perhaps come back on some thoughts on both what you're looking at in terms of. Oh, Lynette wants to come in, so I'll just finish what I'm saying and I'll let Lynette come in to both reflect on how we can what you're already doing, but also how what we've discussed today might prompt within your services, within the organisations that you manage, etc. If I could invite you, and I might chase you all up if you don't mind, because we don't have a lot of time today, and we've got something else on the agenda, and I want to move us on. But I think we've made there are some really key points and some key questions, and I'm also going to endeavour to make sure we answer some of those key questions that have been posed today by speakers. But Lynette, you wanted to come in, and I think you'll be the last speaker on the topic.
Yeah, I just wanted to really back up what Zena was saying about how you go about breaking down stigma around any subject matter. And we've seen it played out in the way that we've been able to destigmatize mental health somewhat and at least raise awareness of mental health issues. And I totally agree, Zena, that we really need role models or leaders or women who you wouldn't expect or suspect have experienced domestic violence to kind of lead on this. And it definitely needs some kind of campaign where women are encouraged to be able to speak out and maybe get support in the way that they do that. And I don't think it's only down to the domestic violence agencies that we have in the borough. So that was one point. The other thing that Zena said there was about power. And absolutely, a lot of violence is about power. We also need to understand that the people that hold the power in order to do something about the domestic violence that is already happening kind of lies with the police and the policing of domestic violence. So I think alongside that, it'd be really good to understand a little bit about how they utilize that power, how successful they are in bringing those who utilize violence as a way of controlling their partners, etc. You know, how good are we at making sure that these things are followed up? Because I think that could actually encourage other women to report things if they felt that there was actually a clear pathway out of that situation. And I'll just say quickly as well, 100% we need to really inform our young people about what a healthy relationship actually is. And however we can do that with all the knowledge, expertise and skills that we have in our various agencies, absolutely we need to go about doing that. So just I hope those helped in some way to just really say that what you're saying, Zena, there, I totally hear all of that.
Thanks, Lynette. Absolutely, those are really useful and supportive comments. Seb gave us a little bit of an intro to some of the work his team is doing on domestic abuse. But we also talked about how important it is for us to talk a bit more about that and understand that a bit more. And so no doubt we'll hear more. But also, I'd also encourage you to connect up if you don't already do that outside of this meeting and have those conversations. I'll say Seb and I had a meeting and we talked really openly about some of the issues that are coming up for women in the borough, and it was a very useful conversation. And I see Mandrew's talking about linking up with the private sector too, absolutely. So making those connections beyond this meeting and this space, and all of us committing to making this a priority. And a question that we ask ourselves when we're looking at the work we're doing already. So thank you. And I feel like we could go on a lot longer on this topic, but we've got something else on the agenda. But we are going to come back to it, and we have talked about making this one of the key priorities for this group, if not the only key priority, maybe perhaps one of two or so, since it's such a key issue for us. We've got a lot to do. So it's a challenge. Let's lay down a challenge to ourselves to think about how we can move forward on it. Next item, and we're moving on, thank you, to item 9, and the partnership plan addressing racism and racial discrimination. And I think, Charlotte, you're going to lead this item.
Yes, thank you very much. And I was just reflecting on that rich conversation and not stepping into it, partly because I was struck by so many similarities in effect with some of the comments that were being made about structural and systemic inequalities around intersectionality and the interplay of gender and ethnicity, how we need to involve people differently in design of services, environment, housing and workforce, and issues of power as well. So, and just the fact that this cuts into everything that we do, so that broader link to inequity and inequalities is so important, and very much the work that we're doing across the partnership plan as well. So really interesting to think how we really sort of optimise the strength of this joint meeting or meeting in common of the Community Safety Partnership and Health and Wellbeing Board in terms of that leadership and sponsorship, but also how we engage with the wider partnership. So really helpful discussion. So I'd like to start with an apology from our part that we didn't circulate the paper despite it being ready last week. So sorry, we had an admin challenge of just not pressing the send button. So apologies for that, but it will be circulated afterwards. And we have got a presentation which we'll just talk through now. Similarly to the presentation that you've just had, this is a bit of a partnership effort reflecting the fact that this is a partnership programme plan. We're going to hear from Christina, and then from Lynette and Charles from Mind, and Neil Bellamy from the police around their particular work on community safety and policing within this work. So the partnership plan is supported by a coordinating group, which is co-chaired by Zena Etheridge and Jeffrey Ocean, both on this call. And the idea is that we have 8 themes which cover most aspects of residents' lives. Each of those has a joint work stream lead from the BCS and the statutory sector, with a real view to trying to sort of drive through the key priorities from a resident perspective. Some of those work through groups, some of them work through very much sort of action sets. It's really very flexible in terms of what makes the most difference, and the idea is that we report to this meeting on a 6-monthly basis, so we'd hope that it'd be one at least of the 2 priorities that this joint meeting takes on. Christina, moving on. So we developed this plan, and we're still developing it. It's very much a co-produced, co-designed space in response to the disproportionality of the COVID impacts for residents from Black minority ethnic communities in the borough, but also the shocking death murder of George Floyd last year and the resultant Black Lives Matter protests, which really sort of challenged us all again. And I think Sharon's point about how many years it takes to see change, you know, we could echo again in this conversation as well. At the same time, a local grassroots organisations calling themselves the BAME Stakeholder Group came together to discuss a real focus on health and wellbeing, and we've drawn those actions into the partnership plan on one of the strands. So moving on, just wanted to highlight these 8 themes. So we're going to do a bit of a deep dive into the first one, which is around policy and strategy with a particular focus on data. And I think very much pulls out Councillor Ahmed's points around how we need to understand better our local communities, have better data around the makeup of and profile of our local communities. And we're going to pull out some of the work we've been doing on that strand. The second health and wellbeing focus has to date focused very much around mental health. So again, picking up Beverly and Lynette's points around sort of the real importance of mental health and core mental wellbeing in for our local residents, but also thinking about how the inequalities that we've seen through COVID have played through. On education and attainment, our particular focus has been around how we work with parents in the system to ensure that their voice is heard throughout the education process, whether that's through attainment or through issues such as exclusion. The fourth area, and particularly again of mental health support, which Lynette and Neil are going to talk to in more detail in a few moments. In the arts, culture, heritage and place area, we've been thinking about our arts and culture strategy and how we celebrate and understand the diversity in arts and culture sector, whether that's as creatives, as audiences or as participants in arts and culture. Our sixth area is really around some of the issues that we've been grappling with early in the conversation around intersectionality, how we respond to hate crime, how people understand their identities and how they see those reflected in the borough around them, and how we can really strengthen the sense that people belong. And again, some of those issues that came through in the previous conversation about design and how spaces feel safe for different communities, how people feel that they're represented in the local community is so important. Our seventh area is around economy and employment, but not just a focus on employment, but really thinking about some of the role models, whether that's as governors on school governing bodies, as trustees on boards, for example, where we see some of the role models for Black residents locally. And finally, workforce, which again, I know was picked up earlier in the conversation, is about how do we really ensure that all our workforce feel supported, feel that they're getting support to progress or to develop, and that we tackle discrimination within the workplace, as many of us work for large organisations employing lots of local residents. So those are the themes. We have a plan that sits behind this. Significant parts of work are going forward. I'm going to hand over to Christina, who's going to talk to the progress on 2 of the strands, and then to Lynette and Neil, who will complete on community safety and policing. Thanks, Christina, over to you.
Thanks, Charlotte. Charlotte, can I just interrupt for a minute? I think someone might have their sound on. There's a little bit of ambient noise in the background. Just make sure if you've all got your sound off, please.
Thank you, Chair. I'll hand over to Christina.
Thank you. Thanks, Charlotte. And just to apologise again for the paper not having been circulated prior to the meeting. That was my fault. So yeah, we'll make sure we have the report with you so you can see the full detail across all of the 8 themes. And just on the themes as well, we're really mindful about the evaluation piece that sits alongside this as well. So we are looking at a couple of dates in February between Jeffrey from Bridge Renewal Trust and Jean from the Policy and Strategy team to host a theory of change session where we'll just work through the objectives that we're looking at across the whole plan to make sure that they feel right, and backwards looking at the actions that we're taking to support the delivery of those outcomes. And then that will inform the metrics that we will be using to evaluate the work that we're doing. So I just wanted to mention that that will be coming up in February, and we'd be really happy to circulate details of that for anyone who would like to be involved in formulating those metrics and making sure that everything we've got in place feels right for now. So I'm going to start by talking, if I can just move on to the next slide, about some of the work that's been going on in the policy and strategy theme that Charlotte mentioned. So data collection was one of our first priorities, again tapping into what Councillor Ahmet mentioned earlier, to make sure that we have a good understanding of what our local communities look like, and recognising that if we're going to have good robust data, the categories and the framework that we use for that in the first place needs to be right. So the policy team, again led by Jean Taylor and Jim Pomeroy, have reviewed the categories used for ethnicity and nationality alongside the other protected characteristics. So it was a review of the whole equalities monitoring form that we're using. And they were really mindful of recognising that the previous categories missed key sections of our local communities. So one sort of key example was the white other category, covering Turkish communities, Kurdish communities, Polish communities, all very different with very different needs. And we really needed that level of granularity to be able to respond properly to each of them. So trying to balance that kind of detailed community insight with also being informed by the ONS standardised categories, so that we can still do that regional and national comparison. So the updated categories were drafted, shaped in consultation with officers from across the council, colleagues from health and the VCS. So once we had that draft form, that was tested by the policy team with a number of different stakeholders and community organisations to get as close to that correct balance between the national and the local as possible. So that updated form has now been approved by our Statutory Functions Board, and I know that the policy team are now in the process of organising a kind of launch for the form across the organisation. So there'll be comms going out around that to make sure that all the services that need to be are aware of it. And we're looking at working towards a more standardised approach across organisations. So it's sitting under the partnership plan, meaning that we want this to be taken up across the partnership, not just by the council. And we also know that it's the first step in a bigger piece of work that we need to do to improve data collection. So part of that being about improving staff's confidence and skills in collecting data. So making sure that they feel comfortable asking questions about things that they may feel are sensitive, so around people's sexuality or ethnicity even, making sure that they've got the skills to do that, and also that they understand the importance of collecting the data. I think when particularly frontline staff are busy and they've got lots of other things to do, just really making sure that that they know how it can help to inform their service delivery and improve that for the individuals that they're working with. And then there's more thinking that we're doing about where that data goes once we have it collected, how we share it across the partnership, how we can use that to kind of tell stories about different people's experiences of the services that they're using. So really happy that that's now complete, and it would be great to think about how we can raise the awareness collectively of the form and its use, and that upskilling for staff as well. The next theme that I wanted to go into a bit more detail on, and I should have said apologies from Jean for this meeting, and I know that Helen McDonough and Paul Butler were really keen to be here to be able to talk through the work in economy and employment themselves. But they had started, I think, but even prior to the partnership programme plan, working on the economy and skills recovery action plan together. So developed between the council in collaboration with the Selby Centre and other partners. And that had a really strong focus on supporting those residents most impacted by COVID-19. So that included young people and people from Black and ethnic minority backgrounds, looking at opportunities in growth employment sectors like care and construction, and opportunities for community wealth building to really target people most impacted by COVID. And they've been working throughout that recovery plan with frontline services like Haringey Works, taking a hub and spoke type approach in different community locations. So having their community navigators based on Broadwater Farm and Northumberland Park, for example, areas where we know have large proportions of Black and ethnic minority residents. So that's some of the background from the Skills and Employment Recovery Action Plan, which kind of feeds into the work that we've been doing under the Partnership Programme Plan. One example from that action plan that Helen and Paul wanted me to draw out was the Employment and Health Programme. So that focuses on creating clear and tailored pathways for residents with health barriers into work, securing employment opportunities for residents with health barriers, and preparing residents for work and supporting them to secure and sustain good work. So I think there's a real intersection and overlap between some of the disproportionality that we see in particular types of health issues and outcomes for Black and ethnic minority people, and how that can then disproportionately impact their opportunities in the workplace as well. So lots of join up between these different strands. So some of the objectives under that health programme are increasing the numbers of young people with learning disabilities, autism and health conditions accessing pre-employment training in the borough, improving access to employment and training for adults who are over 25 with autism, learning disabilities and or other health conditions, increasing the number of Haringey care leavers progressing into good work, design and deliver employment support to adult carers as part of the adult carers strategy, which will run from 2020 to 2023. And then finally, developing a range of employment pathways with anchor institutions and commissioned health and social care providers to increase the number of Haringey residents with health barriers moving into roles within health and social care. And I know there's been some really positive work already with the Whittington, for example, on progressing that. So under the plan, and as I mentioned, all of these things kind of link together and link back to the data collection that I spoke about at the beginning. One of the first areas of focus in the plan is around data and intelligence gathering through our economic intelligence group. So looking across the employment sector for key indicators that will help us to target the actions that we want to prioritise. So looking at things like business ownership, access to workspace, London living wage, skills levels, participation in business networks, apprenticeships take up, representation in different sectors with a focus on higher paid sectors and sectors with potential for progression particularly. And as I mentioned, this will help to inform the work that we focus on improving skills, employment and progression for Black and ethnic minority communities. I know there's been already some really interesting thinking about things like access to workspace and recognition that kind of open spaces that might be cheaper for people to get into are often not accessed so much by people from Black and ethnic minority backgrounds. So trying to do some more understanding as to why people either don't know about the opportunities in those spaces or don't necessarily feel welcome to go and work there and access them. So yeah, there's lots more understanding for us to do there. Then the other kind of key priority under the plan is a targeted and proactive approach to recruiting in an equitable way. And that's being piloted between the Park Service and the Employment and Skills team. So really trying to make sure that we recruit very locally and in a very diverse way. And so thinking through the different networks that we already have access to, the types of application forms that we put out, and the networks that we promote opportunities throughout, as well as the support that we put in place for people who are recruited. So making sure that there is capacity there to not only get people into work, but make sure that they sustain that employment and kind of have the support they need to get over any hiccups as they start out. So we're hoping that this will form a good practice model that can be shared across the partnership, and also that it will support wider community representation from across partners in both in this kind of specific piece, but across workforce more broadly. Just see if I can move on. So I wanted to mention quickly, also very closely linked, is some of the thinking we've been doing under the workforce theme. So I think one of the kind of key priorities that had been around developing a staff survey on race specifically. And another element is the kind of partnership work on recruitment and retention. So there is a big piece of work going on across North Central London EDI working group. And that's identified recruitment as a priority area to affect system change between now and March 2022. The NCL have developed a de-bias recruitment toolkit, which we're all kind of reviewing and looking at and seeing how we can implement at the moment. And within that kind of time frame of between now and March, trusts and partners are in the process of reviewing their recruitment policies with recruitment specific policies and the EDI policies that we hold to make sure that everything that we want to see is reflected in there. So some of the things that we're thinking about in terms of requirements, which we will put out for recommendation for implementation across the partnership, are the application process. So, for example, the length of application forms, what the content of job descriptions and person specifications look like, and also being mindful about the promotion of existing staff. So recognising that that can sometimes lead to kind of recruiting to type. So getting a balance between promotion for internal staff and making sure that we're recruiting externally. Panels was another big area of consideration. So the representation on panels, training for panel members, as well as training for recruitment managers. Another element was anonymizing applications and improving data collection on applicants, interviewees and appointees, so we can see kind of how people are getting on throughout the process and where different groups are dropping off. Adverts, so as I mentioned in relation to the parks piece, the kind of style of adverts that we put out, are they articulated in an accessible way, and being really mindful about where we share them, so kind of just putting them up on our own website and a couple of other places, probably not enough for us to reach that place of equity that we're aiming for. And then also embedding a talent approach for all applicants, so if people aren't appointed, what could have been improved in their either application or interview, and could we kind of look at developing a pool where their skills might be used elsewhere. So that's it, I think, for my updates, and I will hand over to Lynette for the community safety and policing piece.
Unmute myself. Thank you very much, Christina. And thank you very much as well for supporting the work that we do under the community safety and policing, as well as Neil and all his colleagues in the police who you're going to hear from. I suppose a lot of the work that we're doing under this title is around improving mental health support for Black and minority ethnic individuals in crisis and police officers. You know, and people could ask in this meeting, why are we looking specifically at that group? And I think that Christina has already explained that a priority out of our whole coordinating group is that we would always start with data. So looking at the data and being led by the data, and not just making assumptions from ourselves about what the issues in Haringey are around the Black community and the police. So, and we've been very fortunate, actually, haven't we, Christina? Because everybody that we have gone to under this agenda has been very committed and passionate to trying to do something to change the experiences of the Black and minority ethnic community and individuals that are in crisis. So we've looked at the data compiled by BEH and the Mental Health Trust, and this highlighted significant disproportionality with young Black males, and in particular being sectioned under 136 of the Mental Health Act. We were also, we looked at some of the data under section 135 as well, but we really wanted to understand how they came into the mental health system and whether that had improved. And actually what we found was the data was very clear that not only had there been a rise in some of the sectioning under 136, particularly when we went through different periods of the pandemic, the lockdown, etc. But the data that was shared with us gives us a really good picture in Haringey about where those people are being picked up, literally down to the postcode. So we are well aware that in N17, N22 and N15, we have really high rates of young black males coming into the mental health system under Section 136. A lot of those young males, when we look at some of the other data from Barnet and Enfield Mental Health Trust, when they come into the mental health system, they're also spending much longer than their white counterpart. This data that we were able to get from BEH was also supplemented by the police. So not only could we see the journey into the mental health system, but what happened when they got there. And really the police data was the data that gave us more of the granular. So the exact areas that people were coming into the system. And I think even they were able to give us whether anything happened after Section 136 was utilised. And the other interesting thing, I think, about the data that the police were very committed to giving us and finding out, which we really thank them for, is that we also learned a lot about the use of Section 135 under the Mental Health Act. And this is where somebody might not be taking their medication, but here we're entering people's homes. So it's not just that we're picking up young black males on the streets of Haringey that might be causing concern to the community or others, but actually there are also powers being used where we can enter their homes and bring them into the mental health system that had a higher incidence than their white counterparts. I think Neil's going to tell you more about what we are doing alongside the police, but I think it's really important probably to share with you that I think when we set out on this journey around looking at this area, we had lots of different ideas about how we were going to solve this. You know, I think one of them was, well, we'll just get some mental health professionals to go out with the police and then it will all make things better. But actually what we found, because we kept an open mind in our exploration, is that that probably isn't the answer to this problem, and that we really need to understand why in those particular parts of our borough, the same young black men are ending up in the mental health system. And we really want to start to understand whether there could be something a little bit more upstream, you know, whether that is raising awareness or looking at the particular problems. So I think I'm just pleasantly surprised that although we thought that we had the answer, that we are still exploring that. And the other thing that we are very aware of and exploring, and I'm sure my colleague Neil from the police is going to share more about that, is we absolutely recognise that a lot of the police on borough are new. They don't always have a great understanding of Haringey, which the police are looking at now. The other thing is that the range of work or the duties that the police are asked to carry out on a daily basis means that they are actually, their mental health is affected. They are often traumatised by some of the experiences that they go through in a borough like Haringey. And so we can understand some of the tension when they have to carry out their duties under the Mental Health Act, particularly under Section 136. They also understand that what that might look like to the community if you are regularly picking young black men up in this way. It can easily be for the community, it could easily look like the police are just stopping and searching more people. So we know that we've got some work to do. There are lots of talks about training at the moment. So training the police so that we can look after their mental health, more training with the police so they can get an understanding of the community, the complexities, why they are continuing to pick up these young black males. And a lot of that is around the social determinants, poverty, unemployment, etc. so that they can understand why it is that every time that they go out, they seem to be picking up the same groups of people from our community as well. And I know that Christina and others have got a lot more to share. I'm really looking forward to updating you. Anybody that knows me on this call knows that I'm impatient. I want things to happen, but I think the way that this work has happened has been really good. I think we're really starting to understand what the issue here is, and it's definitely something that together, over a sustained period of time, we are going to be able to show the outcomes, I think, of the work that we're trying to achieve together. I think the one other thing I would say about this work is definitely from a kind of Minding Haringey perspective, is that we really would like to get much more narrative from young black males who have been picked up and sectioned under 136. And so I really hope the next time that we meet or I feedback that we can tell you about some of that work. Now, some of that work is going to happen under one of our projects that we're involved in Minding Haringey, which is Black Thrive Haringey. And that's just because it's got its own kind of feel about it, that we hope that those in our community who are young and black or others are going to trust that their voice is really going to be heard, and then we are going to be able to share from the perspective of a young black man who maybe is sectioned under 136 and the things that we can improve. So I'm really looking forward to more updates. And now I'm going to hand over to Neil. And as I said, once again, I just want to thank the police for their commitment and passion, particularly Neil and his team, and not just sharing the data, but really wanting this agenda to move on. So, Neil, it's over to you if you're here with us.
Thanks, Lynette. Yes, I'm here. So what I'm going to talk today about is probably coming at this from a slightly different angle, is what we're doing to protect those young black men, young black women, Asian men and women who are actually in the police service. So it's a core priority for the Met to closer represent the communities that we serve. That's something that we've talked about quite a lot previously. And what we do know is that whilst our recruitment efforts to better represent London are starting to take effect, the retention of black and Asian officers in particular is not quite so good. So what I've taken on side here at North Area is to look at how we better support our black and Asian officers, especially those that are younger in service, that are engaged in uniform wearing frontline duties, where they are sadly coming up against a level of abuse from the communities that they're actually here to try and protect and serve, and actually keep them engaged with the police and keep them here long term, where hopefully their careers can flourish as they progress up the ranks and progress to specializations. Could we go to the next slide, please? So this is talking about the recorded hate crimes against police officers within North Area specifically. I can't bring it down to Haringey level, sadly. So since the 1st of January this year, we can see that the majority of the 98 hate crimes have been based on an officer's race, whether that offence is motivated or aggravated by the race. Obviously, one was faith-based and 14 were homophobic. And I say the predominant group of officers or groups of officers who are subject to these incidents are black, Asian or mixed race officers. A small percentage are noted against white officers, but that is a relatively small percentage. Next slide, please. So here we are in terms of the outcomes. So North Area has the highest detection rate for offences committed against our police officers whilst on duty. So 62% of those 98 offences have resulted in either a charge or a summons against the offender. Of the remaining percentage that aren't yet detected, the majority are sitting with the Crown Prosecution Service. So hate crimes have to go to the Crown Prosecution Service under normal circumstances for a charging decision. So it's not that those offences aren't going anywhere. It's just that they're currently with the CPS, and we hope to get charges in the vast majority of these cases. The ones that do end up being taken no further are predominantly down to significant mental health challenges of the suspect. Either they're sectioned for a long term, the person was heavily under drink, drugs at the time of the offence, coupled with mental health, which again means that it's deemed not in the public interest to prosecute for those offences. Just to compare the 62% there, this compares to a 14.8% detection rate for all hate crimes in Haringey in the year to date. So it's quite a difference. But obviously we're looking at things like the officers are generally recording the offences as they happen. They're putting on videos, or they're happening within the custody suites, which we see quite a lot. And we've got more than one witness to that offence, so it's generally quite easy. It should be quite easy to progress an investigation through to a charge being heard. Go to the next slide, please. I think it's important now to talk about the support for officers, and this is about that, keeping them engaged with the Metropolitan Police, keeping them wanting to work for the police. So I review all the hate crimes that take place against our officers, and I'll make personal contact with the officers as they happen. There'll be a final review which takes place sometime after the offence has actually happened, just to make sure that everything that can be done has been done, whether we need to involve people like occupational health, staff support associations, who we've got really good links to here in terms of the Black Police Association, the Association of Muslim Police Officers, the LGBT Staff Association, and where we need to bring in some specialist help to just try and speak to the officer and help them to come to terms with what happened. You know, these offences, you know, it's easy to say that they're very low level. They're not. A lot of them are verbal only, but we sadly see a number of colleagues in tears because of what's happened to them. You know, they think they're joining the police to really make a difference, and then for them to come into work and be subject to, in the case study below, repeated incidents of abuse. It's really depressing. I mean, how somebody keeps getting up in the morning and coming into work thinking, well, what's going to happen to me today? Am I going to get punched or kicked or called all kinds of names, just by virtue of the fact that I actually want to make a difference in my community? And this is a really sad thing. So this is why we lead it at senior leadership level. I'm very clear on this, as is Simon as the BCU commander, but we've got zero tolerance to all hate crimes, and that obviously extends to the public as well, as seen by the fact that we're second best in the Met for detecting hate crimes against the community, but absolutely zero tolerance to it. We expect colleagues to be standing up and challenging poor behaviour that's been witnessed out on the streets, and we look after each other, and that's where we get improvements. So coming on to the case study, and this officer, he has been subject to the most offences from any individual working here. So there was 8 separate hate crimes happened to this one officer over a 12-month period. His inspector is an Asian inspector who's spoken to him a number of times and has that empathy and understanding around the things that he's suffered in his own career. And I've met with him twice as well in person and just spoken to him at length. He's a lad in his early 20s. He's from North London, and he has seriously considered leaving the police because he's really struggling to just keep coming into work. I've spoken to the chair of the Met Black Police Association, Chris Excel, and Chris is going to be coming out to spend a bit of time with both the officer and a few of the teams here, just in terms of the support that the BPA can offer. And also what I've done as a last resort is we've moved the officer through his own choice, I hasten to add, because if he wanted to remain on a response team, he could and he would. He's moved to deal with a specialist unit within CID at the moment. And the reason for that is, for the response team officers in particular, we can't pick and choose the calls that are coming into us. And a lot of the times he'll turn up to an incident and he's immediately singled out and abused. There are a number of factors behind that. He's a very big guy, so he can't hide at the back of the line in terms of the police officers going into somebody's address. But that doesn't mean it's any less harmful and impactful on him. So I've spoken to him at length, and we've offered him an attachment away from the front line. He'll still be out on the streets, but he'll be dealing with slightly different crime types. And hopefully that just gives him a bit of breathing space to, hopefully, in my opinion, reconsider wanting to exit the Met and sticking with it, and maybe looking at not coming back to the response team in the short term now. I think that was everything from me on this one. Thank you.
Thanks very much, Neil. I'll just move on to the next one. So yeah, really helpful and sobering, I think, to hear about the experiences of officers as well. And I think that's why the piece that Lynette spoke about in terms of the mental health support that we give to our officers locally too, being so important, and thinking particularly about that that dynamic of some having to face not only kind of stressful and traumatic experiences through doing their job, but racism on top of that. So I'm going to hand back to Charlotte just for the kind of closing discussion on the item.
Thank you. I just wanted to say thank you very much, everybody, for that. I recognise we're running out of time, and I also recognise that we haven't been able to cover all the things that we're working on across this plan. I suppose I just wanted to sort of highlight a couple of things that probably haven't shone through. So the first is our developing a series of networks. So we're just in the process of setting up a Somali network, which will be work, in a similar way, but with its own I'm sure very focused ways of working to the Turkish and Kurdish network, and that's really about supporting Somali residents and local community organisations to work together to interact with us as statutory partners and to make sure we have the right conversations, can share data and insight, and can understand the priorities for those communities. Also looking, we're working with a series of organisations through around a Latin American network, so actually beginning to build that more in-depth profile and understanding of local residents to move forward. I think important to say there was a huge amount of work under each of the strands. We're very keen for people to get involved in your organisations. I know a number of you, there'll be other people sitting on the coordinating group potentially, but I suppose one of the questions is that are there areas that you'd like to support the work of the partnership programme plan? As Christina was mentioning, the point around data is really significant to us because we can then better understand what is happening. So the new equality monitoring form, it might sound a little dry, but it is absolutely critical to us understanding what is going on in our local communities, and we'd really support any additional organisations joining so we can have comparative data locally. And then really thinking about how we as organisations can promote equitable access to employment. We've seen some really good work on promoting, for example, Black residents becoming involved as governors locally, and really wanting to think how we can extend that to our other governance mechanisms across the borough that might be at multiple levels within the borough. So just some questions. I'm not sure, Chair, though, to what extent we have any time for these questions, because I think we might have run out of time somewhat. So apologies for that.
We have a little. I just wanted to say I welcome you mentioning work with the Latin American community. Just when I attended their meeting recently, I know it came up, the issues around categories came up, so I won't ask you to respond on that, but I know there was a question. The question was in my mind was that I know that when we have data sets, we want something set so we can compare every year, but at the same time thinking changes and evolves as we learn. So my question was how much scope there was in there, especially when we're listening to groups who might be saying, okay, well, we haven't got the right countries, or we haven't got all countries listed, whatever it is. But that's a general comment, and I don't think we need to respond. And we don't have a lot of time because I'm conscious there's another meeting onward. But thank you so much for that. Really, the meeting's so good. People have gone and come back, I just admitted someone, but I think that really important to go through and to see that work and to see the level of partnership as well, I think. So thank you all for that. And we were going to have just a briefest discussion about what next for this joint meeting space. And I know, Charlotte, you were going to lead on that. But I thought I might introduce it somewhat and bias the whole thing by saying my suggestion is that these two pieces of work that we've looked at today, which in and of themselves are huge, but have plenty of scope for collaboration and for us to ask ourselves and demand more of ourselves, our suggestion is that they are the key items that we look at for the next few meetings. There is a question about whether or not we meet frequently enough and what the balance between being strategic and operational. And I don't know that we've got much time to talk about those things, but there are the things that are on my mind and others I know. Charlotte, I don't know if you want to come in on that issue.
Yeah, no, I think we recognise that at the moment these are scheduled sort of 6 monthly, and we've just, as it says in the title, it's a meeting in common of the two the partnership boards, and really thinking about does it constitute a sort of a more established sense of how do we come together. So to provide that joint leadership, we recognise there's quite a lot of sort of points of connection, whether that's around intersectionality, mental health come up as a theme, for example, workforce has come up as a theme across these different areas, and how might we sort of harvest the joint strength, as it were, of the two boards going forward. I think people recognise it's great to have so many people on the call, but the sort of challenge of getting dates in the diary is significant. It's really great that we're all together. So I think we felt that 6 monthly was a sort of good rhythm, but to do that we really need to make sure we're sort of focusing. So I think the two priorities, as Councillor Dusneves has said, we were hoping that these would be shared, but thinking there about how can we work together on some of those joint themes. So mental health, is an evident one coming through from that. So that's what I wanted to say, Councillor Dusneves, by way of introduction to that last point.
I'm conscious of time, but I do, if anyone wanted to come in on those two issues, otherwise I was going to make a suggestion about how we go forward, but I don't know if anyone does. No, not in any burning way. Okay, well, my suggestion is that it is difficult to get in the diary, and there are a lot of us here, and we maintain the frequency, but that we go away and have a lot of think about how we might have breakout sessions or groups in between time, and we talk a little bit more about progressing the operational side, and then we have a little think about how we use this time when we're all together in a big way to talk at the strategic level about some of the work we're doing and the priorities. Does that sound reasonable? I see people nodding, so in that case that's what we're going to do. Thank you all for your time. I'm going to close off the meeting in common of Health and Wellbeing Board and Community Safety Partnerships. Thank you all for your contributions and input, and I know that the CSP now continues on, and I think, Simon, I'm handing over the baton to you. But thank